Hey everybody, Daniel Rainier, Medication Monthly. We're trying something new. We are doing videos now. I know it's kind of scary. I'm sorry. Apologize about the mustache. All right, anyways, today we're talking about atropine, and I have a special guest with me. I have Noah Gunn. He's going to help us out, all right? So here he is, Noah Gunn.
Hello everyone, Firefighter EMT Noah Gunn here. We're going to be talking about the mechanism of action for atropine. And atropine is going to be a parasympatholytic, and basically what that means is it inhibits the action of acetylcholine at the postganglionic parasympathetic neuroeffector sites. And a lot of these are big words, like acetylcholine, that is just a neurotransmitter. And going back to parasympathetic and sympathetic systems, a parasympathetic is going to lower your heart rate down, and sympathetic is going to raise your heart rate. Just remember, rest or digest for parasympathetic and fight or flight for sympathetic.
Hey everybody, okay, so we're talking about indications, firefighter EMT. Noah Gunn already talked about the mechanism of action. So we're going to talk about indications, right? Indications are hemodynamically significant bradycardia. Bradycardia is underlined because bradycardia is pretty much what we're doing it for, right? This is going to be a bad blood pressure, bad skins, altered, basically somebody that is unstable, correct? Okay, so the other thing is OPP, organophosphate poisonings, when people are sludge them or dumbbells, however you want to remember it. We'll talk about that later. So indications for atropine. All right, so we talked about indications. We're going to talk about contraindications. These are pretty important, right? Because Noah Gunn said this is what could kill people. All right, so tachycardia, that's a big one, right? We're not going to give it that's a contraindication. We know that we're looking for a bradycardia. Okay, hypersensitivity, we don't know unless we ask. So we always have to ask history, allergies, and meds. See if they've had this before, or if anything that's happened before and they've used atropine on them and they had a bad reaction or some sort of reaction. Unstable cardiovascular status and acute hemorrhage and MI or ischemia, not infarct. Okay, because we're not trying to make more oxygen demand for the heart and make it worse. Okay, we don't want it to happen like that. Narrow angle glaucoma. So we're talking about maybe the toxicity of atropine and or worsening the narrow angle glaucoma, because some of the things are blind as a bat, red as a beet, mad as a hatter, dry as a bone. We don't want to worsen these things for toxicity. All right?
So going into adverse reactions, your patients might be experiencing some headache, some dizziness, palpitations, nausea, vomiting. Might experience some tachycardia, some dysrhythmias, and if you push IV a little slower, it might be a paradoxical bradycardia. And like Daniel was saying, with organophosphate poisoning, you gotta watch out for like sludgium and the killer bees. So sludgium, that's just salivation, it's lacrimation, you got urination, defecation, you got gastric upset, emesis, and muscle twitching. So be on the lookout for that. And with organophosphate poisoning, it's also important to make sure that you're in a safe environment too. You don't want to become impatient as well. And then going into the killer bees, you want to watch out for bradycardia, bronchorrhea, and then bronchospasm. And just remember for atropine toxicity, you have blind as a bat, dry as a bone, mad as a hatter, red as a beet, and hot as a hair.
All right, we're going to talk about drug interactions with atropine. So some of them that can potentiate or potential adverse reactions are digoxins, cholinergics, and physostigmines. The physostigmine, you're going to be treating glaucoma because it crosses the blood-brain, and it's treating the central nervous system effects for the atropine overdoses. But also it can reverse both central and peripheral anticholinergia. So it has the opposite effect on the thing that we're trying to actually do. So things that enhance the effects are going to be antihistamines, procainamide, quinidine, antipsychotics, benzodiazepines, and antidepressives. So people are on a lot of these, right? We have to make sure we get a good history, allergies, and meds. That way we know what can potentiate or enhance.
All right, going into how it's supplied, we have these purple boxes. It's 1 milligram per 10 milliliter. So what you're gonna do, you're gonna pop it out. We have the sinus bradycardia under 40, but it's supposed to be under 40. And your medication, pop them, screw it in. And for the dosage, it's gonna be 0.5 for some bradycardia. You're gonna screw it in. And remember, the max dose for this is 3 milligrams. We need to make sure that we're doing the 5 rights. right patient, right dose, right medication, right time, and right route. So the route's IV, it's the right medication, right patient, it's the right time to give it. So if we're doing 0.5 for bradycardia, we're gonna push half of it because I said it's supplied 1 milligram. So push half, and we'll see if that works. We give it 3 to 5 minutes with a max dose of 3 milligrams, and he converted.
All right, so in summary, thanks guys for learning today. Atropine. So make sure you always do your 5 rights. Make sure you're doing the right route, right dose, right patient, right
Route and right time.
We said route twice, but that's okay. And always treat your patient, not your monitor. Make sure that we're wearing our PPE. Watch out for pregnant ladies.
They'll get you. They'll get you every time.
All right, everybody, in summary, thank you for learning, and always wear your PPE. We're talking about our 5 rights. Please do your 5 rights when any medication is being given. We're talking about atropine today, and that was unstable bradycardia. We know what's unstable versus stable. Onset is pretty rapid, 1 to 2 minutes. IV, the peak is 1 or 2 minutes, and the duration is 2 to 6 hours. So some of the special considerations, we're talking about pregnancy or pregnant women. Go ahead and be careful with that. It's category C. It's not really tested or known. So moderate doses will dilate the pupils. We talked about that. Blind as a bat, red as a beet, mad as a hatter, hot as a hair, and dry as a bone. Okay, so don't forget the toxicity stuff. Special thanks to Noah Gunn and Dr. Price and Captain Mattingly and also Captain O'Hara for being our patient in the ambulance today. All right, guys, we'll see you again soon.